In 2017, the University Department of Rural Health supported over 4,000 placements. That's 600 nursing and allied health students to have a great rural experience in regional South Australia. As a University Department of Rural Health, we are a team of academics, professional staff and local health professionals committed to address workforce maldistribution in regional South Australia. Our role is to work with our communities and academics in our universities across South Australia to support healthcare students, that's nursing and allied health students, to come to country. We also have a role with working with our communities to increase rural health service capacity and quality and conduct activity at improving the health and well-being of Australians who live in regional South Australia. We are one of 11 across regional South Australia, and our University Department of Rural Health covers the whole of South Australia. We have 8 major training sites. Our major hub is based in Whyalla, on the Whyalla campus, but we have a training site in Port Lincoln, in Pickawea, in Port Augusta, in Port Pirie Hospital. We've just opened a new training site in Summit Health in the Adelaide Hills. We have a training site in our campus in Mount Gambier, and we're currently sourcing two additional training sites in the Riverland and the Barossa. And the purpose of these training sites is to support students who come to country, to help them find somewhere to live whilst they're in the country, but also to provide some additional transportation costs to actually get them into country, and to actually engage the local workforce, to actually support them in their professional development, to enable them to be better supervisors for students, to drive service quality, but also to conduct research aimed at improving the health and well-being of regional South Australians. Over the next 10 minutes, I'm going to talk about some of our activity in the areas of rural workforce development, rural training strategies, workforce outcomes, and some of the areas of increasing rural health service delivery. Our biggest challenge in terms of the Department of Rural Health is the workforce maldistribution that currently occurs across South Australia, and this drives much of our activity. So in this study we're actually doing here, we want to understand the health needs of people living in regional, rural and remote Australia, to identify areas in which health systems can be improved for Australians who live in the region. And we're currently in the process of collecting data on the characteristics and the health and the lifestyle of people, and the profile of health services and the treatment in which people currently receive in regional South Australia. We're also, in the survey, we're asking people to give us information on the barriers which they experience, in particular in terms of accessing services. So the survey's commenced. It's gone to 162,000 households in regional, rural and remote South Australia, and some of you in the audience may well have received the survey, so I'm pleased with you. So please take time to actually complete that survey. It's really important for us. The other project we're doing is we want to profile the health workforce in regional, rural and remote Australia. We want to understand the demographics of our health workforce, the skill mix and its distribution across regional, rural and remote South Australia. So we're going to do this by interrogating the census data. And we've got some preliminary findings, and again, these come with a health warning. But so, for example, some of the areas which we've identified, there were 35 dietitians who work in regional, rural and remote Australia, but there was 194 who work in Metro Australia. And this is in a country or in part of our country where we seem to have greater challenges in terms of long-term conditions, where dietitian expertise is particularly important. In terms of occupational therapists, there were 96 working in the country in comparison to 622 in metropolitan Australia. Psychologists, 88 were working in regional, rural and remote South Australia, in contrast to 863 in the city. Physiotherapists, there were 215, were working in the country in relation to over 1,100 in Adelaide. So I think some of these initial findings just bring home, and it certainly brought home to me in terms of the real maldistribution of the health workforce. And that just identifies the really important role that we have, all of us in this room, in supporting the students who actually come into country. This is another area we're going to focus upon, is in the area of schizophrenia and the interplay between physical health and mental health. Across the globe, if you have a diagnosis of schizophrenia, you die 25 years earlier than the general population. The biggest cause of death is cardiovascular disease. What we don't know is, if you have a serious mental health problem living in regional Australia, do you experience some of the same significant health challenges that the rest of this population do? So what we're going to do, and this will be the first study to do this, we're going to profile the physical health of people living with a serious and enduring mental health problem. People living in regional South Australia have greater propensity to developing long-term physical health conditions, things like cardiovascular disease, recovery from a stroke, arthritis, tend to be up to 20% higher. This is important for this interplay between mental health, because if you're living with a long-term condition, approximately 30% become clinically depressed. This is important because if you become clinically depressed, it has a much negative impact on your physical health condition. So this is a piece of work we're going to do. We'll be starting in September across all of our major training sites. So we'll be targeting primary care workers to actually screen for depression and then enable this group of workers to actually signpost this population on to actually get some help. In regional South Australia, there's a particularly key challenge for us in terms of accessing podiatry services. And South Australia seems to have some of the highest amputation rates in the country. So this is a project we're doing in our Whyalla campus, and this will be in the Jubilee building, where we will establish something called a student-assisted clinic, where in partnership with Whyalla Hospital, we've employed a podiatry academic. The podiatry academic will supervise students in our student-assisted clinic. So as well as bringing additional podiatry students to our community, this will also increase the capacity of podiatry services on the peninsula. And this service will be opening in March 2018. Coming to our key messages, as a Department of Rural Health, we're about facilitating future workforce learning. Our key metric in terms of how we want to be performance managed is our ability to demonstrate bringing and supporting more students to actually come and practice in the region as the future healthcare professionals. And through this, we will increase the quality of rural health service and help address workforce maldistribution in regional South Australia and the nation as a whole. Thank you.